I'd like to welcome everyone to Evening Rounds. This is a good turnout tonight. I would like to give you a bit of background on Evening Rounds and introduce some general housekeeping items and our speakers for tonight. For those of you who are new, Evening Rounds started as informal gatherings for healthcare and social media community on Twitter, and we've now grown into a monthly speaker series that provides information, inspiration, and connections around health communication in our province. Evening Rounds is a community. It's a chance for us to connect face-to-face and to see the work that our colleagues are doing to promote health. It's often a place where you can learn something and you can share your stories and get some help and think about things a little differently. For those of you who might be live tweeting tonight's event, you can use the hashtag eRounds. That's lowercase e, capital R rounds. And the other hashtag is the HCSMCA hashtag, which is the Healthcare and Social Media Canada tag, which is every Wednesday, correct? There is a conversation that happens online, so if you follow that hashtag, there's usually a moderator, and it's pretty lively, and your feed will fill up quite quickly. We have Wi-Fi in the room. Do we have details about, does anyone have questions? This Evening Rounds. We are videotaping the session. The videos appear on the Evening Rounds website, usually a couple of weeks after the event. One bit of digital high-end classroom technology is that when you would like to speak or ask a question, there's a microphone on the table in front of you, and if you just press the little button on the base of the microphone, it'll light up, and then you can speak. And then when you're done speaking, press the button again, and it will turn off. So that is how the microphones work. We would also like to thank our good friends and presenting partners at Providence Healthcare who have invited us to use the facilities. And here with us tonight is Director Justin Karasik, who's going to say a few words.
Good evening, everybody. Thanks again for being here tonight. I guess everybody, actually I was going to make a hockey joke, but I don't know. I better not even go there. But my name is Justin Karasik, and I'm the Director of Communications for Providence Healthcare. And on behalf of Providence, I'd like to welcome you here to St. Paul's Hospital and to Evening Rounds. I think this is Volume 8. Thanks to everybody for joining us in person and on Twitter. We are extremely proud to be a co-sponsor of this series. And a big thank you goes out to Signals Design for making the speaker series happen month after month. I've been really looking forward to this session in particular, as I've spent the last couple years trying to convince our senior executive team on why they should invest in a digital and social media communication specialist and an overall digital strategy. And I continue that battle day after day, week after week. And so when I speak to them about things like Twitter, Facebook, YouTube, and an overall digital strategy, I'm often met with a little confused looks and a lot of skepticism. Because like most healthcare executives with non-existent budgets, they want proof in the form of hard numbers that show how our patients or our organizations will directly benefit from such an investment. Unfortunately, the data needed to make this case is dispersed and often confusing. And analysis takes some time, something that my small communications team doesn't have. So what I'm hoping to take away from this evening is a better understanding of how to get useful data, how to work with it, so that I can effectively make the case for investment in this game-changing environment. So no pressure, Janelle, Julia, and Ian. Okay, thank you.
Thanks, Justin. So I'll introduce our speakers tonight. We have two of our in-house team here with us, and we also have our first speaker. Ian Roe is with us tonight. He comes to us from St. John's, Newfoundland, and Newfoundland. How to say it again?
It's not Newfoundland, no.
Yeah, Newfoundland. But Newfoundland would be a little more
Fun in the middle.
fun. Okay, Newfoundland. Okay, excellent. Let's see. He joined BCC DC in 2004 as part of their communications team, and now continues that work and as an immunization promotion specialist. He is the content strategist for the BCC DC, where he splits his time managing the center's website as well as leading immunization promotion efforts. We also have Janelle Chung with us as the digital coordinator for Signals Design Group. And she has worked with healthcare communities and the broader public to connect the two. She has worked at Burnaby Hospital Foundation, where she helped launch their 60th anniversary campaign. And Julia Vyse is a writer and digital strategist in Vancouver. Her day-to-day life includes using data to make recommendations for new campaigns and iterations on those campaigns once launched. And she's keeps me busy on campaigns that I have worked with her on. So without further ado, I'll have the team take over.
So thanks everyone for the intro. I think Justin did a better job. I was going to start with this slide to put everyone in the right frame of mind because there's tactical takeaways but also strategic ones. And so the strategic ones are proving the value and utility for digital communications, convincing others to invest in long-term digital communications, and then analyzing more than your page views. So how this presentation is going to work is first I'll talk about goal-driven analytics, and then Julia will talk about the tools and techniques to bring data across channels together, and then Ian will talk about a case study from the BCCDC. So I titled my section Asking the Right Questions, and this is really sort of a roadmap for people who are about to present analytics to their key stakeholders. So this is geared towards an internal audience and not necessarily to the public. And just some advice and tips to really present your data in the best possible light. So we're going to go beyond what I call the counting metrics, which are your website page views, your Twitter followers, your Facebook page likes, and your YouTube video views. I think everyone is familiar with that, and everyone understands that, so I'm not really going to be talking about that today. And they might actually not matter as much as one thinks. So there's no point knowing what without knowing why. So data is just out there, but you need to figure out why you're looking at it. So the first question you should ask yourself are, who are your stakeholders? And for a healthcare organization, this usually means an executive or leadership team. It means human resources. It could mean media and public relations, the foundations, some donor engagement, and researchers if you're part of a researcher organization. So it's important to align their goals with your goals to really, show your analytics in the best light. So why do you want to align the goals? It's to help others make better decisions. And if they can make better decisions, they can look better, and then they see the value in your work. And then they can invest in digital communications. And it also helps you keep track. So what are these goals look like? I'm not talking about the numerical social media goals, like increasing your Twitter followers by 10%. I'm talking about your organizational objectives and how can you align these goals with your analytics and data. So these are a few organization objectives that I've seen around healthcare and research organizations, and it might be familiar with you guys as well. They might come from your communication strategy, or you might have inherited them from your executive teams. So increase transparency of our operations, be recognized for leadership in research, promote attendance at events, and enhance transdisciplinary involvement. So what do these goals actually look like in terms of digital communications, and what questions should you be asking when you're trying to resolve these questions? So for the first one, increased transparency. It's going to look like longer conversations. Maybe you're going back and forth on Twitter for a couple tweets. Maybe it's Facebook comments that are a bit longer. There's more people sharing information. They're not just retweeting your announcements, but they're actually talking about it. And they're most likely asking more questions. So the type of conversations that are happening, it might increase in volume, but it's also going to change in quality. Second, what is being recognized as a leadership role in translational research? It's going to look like more mentions. It's going to look like more alerts, referral traffic from other sources, because now you're a credible source for information. They want to link with you so they can get more hits on their website or their social media channels. It's also going to show that you're going to affect trends. So if you're really the only person talking about a particular type of research, then you might actually affect trends. And Julie is going to be talking about Google Trends in a second. And also you're top of mind. If they want to do a research study with you, they're going to think of you first. So maybe you're ranking higher in Google search. Promoting attendance, it's going to look like more shares. It's not going to look like more conversation. It might just look like more likes or referral traffic to your website. It's going to look like more talking about this, which is a metric on Facebook, which basically shows that people are talking about you, not in a gossip way, but in a really great way. And then earlier RSVPs, or more RSVPs. And lastly, enhancing transdisciplinary involvement. What does this look like? So let's say you're putting out a news article on cancer. You have other articles tagged cancer. Maybe you'll start seeing hits on those related items. You might see activity across channels. So through Twitter or Facebook or your YouTube channel, you might see more hits at the same time. And then employee interaction. This one's a bit more difficult to measure because a lot of people won't self-declare. But there's still other ways you can try and track down employees or see if they're, talking about your organization. So with this in mind, how are you analyzing your data? And there's a lot of ways your story can actually get lost because there's so much information. So I'm just going to talk about 3 quick things that people might not necessarily be looking at. So not knowing your audience. And what we talked about with different stakeholders, they have different goals. Your HR department is not going to have the same goals necessarily as your media department or as your executive team. So if they have different goals, you shouldn't be showing them the same numbers, and you shouldn't be showing them in the same way. So don't assume your analytics apply across the board. Secondly, there's usually a lack of context. The things you're looking at for external context are, holidays, National Stroke Month, for example, if you're a heart and lung organization, world news, trends in technology and social media events, your own events, or your partner organization's events. These are things that you take into account when you're making your comm strategy, but they're not always things you take into account when you present your analytics. But you should, because it adds context to your numbers. And lastly, measuring where people aren't. So an example of this is you're looking for more internal traffic, and you're looking at your website data, and it's saying you're actually getting a decrease in traffic. So what does this mean? Are your campaigns not working? Well, maybe you're just measuring where the internal people aren't. If your website is optimized for the general public, your internal staff aren't going to go there. So the things you might be wanting to measure are your newsletters or your intranet activity. And then on the flip side of that, only measuring where people are. So it's really easy to get overwhelmed by the multiple channels that you have to look through. But there are other channels that you might not be focusing on. So let's say Tumblr. It's not necessarily as popular of a blogging platform in healthcare, but there's a lot of great science conversations that are happening. And for the people who've been reading kind of Tumblr news, it just got bought by Yahoo for $1 billion. So it's a really big market, and your main audience might not be there, but you should probably keep an eye on it. So this is just to say that data are just numbers. They actually don't mean anything until you assign meaning to them, and they don't mean anything until you know what you're measuring for. So this is important because people say, oh my gosh, this YouTube video only has 100 hits or 100 views. So what? What does that mean in the context of your analytics? What does it mean for your strategy? So everyone kind of looks at data in different ways. If everything is good and positive, in the positive trends, you're increasing follower counts, then you're very happy and you don't really care that much about your analytics. It's really when there's big changes, big dips, or unexpected changes where people start to wonder how they should react and how they should analyze their data. And in this sense, the goals can really guide which numbers you're looking for and how you're going to react to certain things. So I'm going to go through 2 scenarios, and it's really just an exercise for you guys to put yourself in a certain frame of mind. If you were in this situation, would you ask the right questions for your organization? So the first thing is an employee video. A lot of organizations will have this. They have a video, and it's great because video views are really dynamic on a website. A lot of people will look at them. Your goal from HR, one of your stakeholders says, they need more video views. They're only getting 100 views. Can you increase promotions? Maybe you're doing something wrong. What's happening here? So 2 things that you should look at. One is, what is the actual goal behind this? Because more video views doesn't mean anything, right? What is your video trying to change? What kind of behavior or action do you want that person who's viewed your video to take? The other thing to think about is, how is this video being shared? So if, for example, a team leader is showing this video to the 25 people in their group, it's only going to show 1 view, but 25 people have seen it. So really just know the context around how your information has been shared. And in terms of action that you've been taking, do you want more engagement from your staff? So let's say the video is for engagement. So you should monitor your social media channels, monitor hashtags that you're trying to promote, monitor conversations across different channels just to see if that's actually been working. Or is the goal of the video increased knowledge of research studies? Then you might want to look at increased hits to the research studies portion of your website. Another thing, just quickly to add to this, is if you are in charge of your Google Analytics account, then you might want to create events, or what are called events, for video views, because if your video is embedded on your front page, it doesn't count it as an activity. But if you have it as an event, then you can actually see some of the video views that are happening and when they're playing and when they're pausing the video, if you enable that. The second example is a little bit more complicated, so bear with me. So I use this example because I get this question a lot. Referral traffic has decreased. Is this a good or bad thing? Search traffic has increased. Is this a good or bad thing? What should we do? Should we change our website? Are we doing the wrong things? So first of all, look at all of your data and don't make really fast assumptions about things. So for this organization, their goal is to have more interaction with their partner organizations. So you can see on the left side, in November, their referral traffic was 20%, and then in May, it was 15%, so it's decreased. And for people who don't know what referral traffic is, it's when another website links to yours. So according to their goal, this number is actually not great for them. And why could this be? It might be a change of staff. Maybe people aren't connecting anymore. It could be broken links, so you should check out your referral sites links if they're still working. It might be that information isn't relevant, or they're getting information from other sources. So you can see here the campaigns in yellow. That is your newsletters. So they might be getting information from there instead. The second thing to look at is your search traffic in the blue. And so that's from Google or Yahoo or Bing. It's increased a lot. So one point here is that it might not actually be increasing in numbers. It's just taking over the percentage of people that they've lost in referral traffic. So this pie chart needs to add up to 100%. So if you've lost overall numbers in visitors, so let's say you've lost 800 visitor views within these 6 months, that's what it's accounting for. It's not necessarily saying that you have more search all of a sudden. So that's a point that I think a lot of people will miss when they're looking at their analytics. And lastly, I want to talk about bounce rate. So bounce rate is the percentage of visits that only go on one page. So if I visit your website, I'm on the home page, and then I leave, that's a bounce rate of 100%. Usually not a good thing, but it depends on your situation. 100% is pretty high, though. And in this case, it's increased by 10%. And this might, be a cause of concern because 10% is a lot, especially when it's getting into the 50s. One thing to consider is the fact that your search traffic has increased, right? Remember from the last slide, search traffic means that the search engine doesn't really know what you're looking for. Referral sites know what you're looking for. Direct traffic knows what you're looking for, but search isn't always correct. So that's also what's accounting for an increase in bounce rate. So I know that was really quick, and analytics is very, there's a lot of information there, but hopefully just an overview of seeing how the data relates to each other can kind of help you make some assumptions. And so lastly, I just wanted to give tips to provide you guys to show value and context for sharing analytics with others. So like I said, this is for an internal audience. This is trying to get buy-in from resistant researchers or from an executive team who doesn't want to invest necessarily in a social media or digital communications person. So it's not just numbers. The first thing you need to look at is, are you speaking their language? What kind of things are they responding to? Are they researchers and responding to hard numbers? Are they maybe more related to budget? So they want to just see the analysis and how are you saving them time? Are you saving them money? So some of these things in terms of how you display information will change depending on who you're talking to. The other thing is just to be aware of what numbers they're looking for. So maybe your executive team really wants to know your page views. So you still show them the page views, but then it's up to you to educate them that it's not the only thing that matters, and you should show them what numbers that they should be looking at. Often they don't really know what they're looking for. They just heard it in an article that we need more page views, and they don't know what that means. So. Second, highlight conversations that would appeal to your audience and supports your goals. So this isn't numbers, this is interaction and engagement. So one of the examples that I have, we have a client who wants to create a safe and secure environment online. And how do they measure this? You can't measure safety, but you can measure conversations where people are voluntarily adding their personal stories, where there's no more trolls that are happening, so they don't see any spam, and they feel, okay, this is a safe place, no one's going to bash me, no one's going to say any bad things about what I'm saying. So that type of conversation shows that you're starting to build a safe space. Group data together. So Julia will be talking about this in terms of techniques and tools to combine all of your channels. So really it's just adding context with multiple data points and with external events. And always have a baseline measurement for your organization, because you can compare with others, but other organizations don't have your audience, don't have your capacity, and don't have your strategy. And lastly, show your competitors. So this is a big one for people who are resistant researchers, because researchers tend to have, you know, this idea of they want to be first, they want to publish first. I mean, I think it's for a lot of people, they want to have the #1 organization in their field. And so as an example, we had a session with some researchers who are very, you know, they're at top of their field and they felt really confident in what they were doing. And we showed them Google rankings, and they're far, far below a lot of their competitors. They did not take it very well. They're quite angry because they knew the caliber of work from those organizations, and they also taught some of those organizations. And so to see their students rank higher, they started to see, oh, maybe we should get into this digital communication space. So that's another thing, just to rile people up a little bit and to show the competition, because if your competitors are there, maybe you should be there too. And lastly, I just want to end with saying that analytics is just storytelling with numbers. You guys are all communicators. This is what you're good at, is telling stories and telling it to the public or to different audiences, and making sure your communication and your organization goals really align with your analytics, because this is the story that you're telling. Data isn't just another layer, it's just more context for the information that you're sharing. So that's just what I wanted to say. I wanted to give a bit of background, a bit of context in terms of how you should be reacting to data. Now I'll be bringing up Julia, who's going to talk about tools and techniques to measure across channels.
That was awesome. I totally don't want to follow that. Hi, everybody. So I'm going to talk a little bit more about how we use all of these different pieces of data together now that we've figured out some of the ways in which we can plan what we're going to do and what goals mean for when you're actually choosing data. So your info is kind of everywhere, and you have to figure out a strong way to choose and use your data. You're going to get, once you start using these tools, way, way more pieces of information than you could ever possibly need. So you really need to make strong choices about what it is that you're going to present and what is relevant to you. So very quickly, we can look at where your information might come from. And it comes from lots of places. It's everywhere. It's all over the place. There's way more than just this. So choosing what information is important and putting it together in a way that makes sense, exactly what Janelle was talking about, storytelling with numbers, is a key part of actually using this information in a useful way. I'm going to give you an example. Here's some video statistics from one YouTube video from a local musician. These are public. You can get them anywhere. You can publish your data wherever you wish on YouTube. And we can see that there's plenty of stuff in here. There's lots of views. There's trends over time. There's some referral stuff in there. There's lots of data points about this video, but without any channel context, without any sentiment, without any additional information, the meaning it's useless. It doesn't actually tell us anything. I'm going to go you another one. This is Facebook Insights. This is what I like to call going down the rabbit hole. They give you way too much information. So we can see that this is a sample of how people are talking about this person's page. They get a talking about this metric on one side, and they get a viral reach on the other side. Healthcare, viral reach, anybody? Does anybody know what it means? I didn't either. Facebook viral reach is the number of unique people who see a story published by a friend about your page between your chosen dates. I have no idea what exactly that, no, I'm lying, I know what it means. People would create a post about your page, they think that it's important. The viral reach is other people who see that person's post. They could have said that very simply. But it means that, what does it mean for the people interacting with you on Facebook and on your other channels? These are things that Facebook itself can't actually tell you. You need to make decisions about what is happening. You need to make decisions about what channels you're on, how they interact, why they interact, and what it is that you're trying to accomplish. So making decisions about meaning of the data is a big part of your goal setting. It takes a lot of practice, and it takes some tools. So I'm going to use some of my time to talk about tools. This is a planning tool called trends.google.com. It's Google Trends. So looking at it, we can see, this is not an ad, by the way, on the bottom. These are just popular trends that go on right now. So I'm going to look at personalized medicine in Google Trends. And I can see right off the top that there's quite a bit of interest over time, over the last few years. This is from 2005. It's free, by the way. I'm going to add to that cancer management. And we can see that over time, these two topics are starting to come together a little bit. People using search engines are starting to realize that in some way these are connected. I can add in predictive medicine too, and I can see that very few people are talking about this on search engines just yet. Scrolling down, I can see some regional interest in these various topics. I think this is pretty cool. I can look at what's happening in personalized medicine. These are conversations mostly happening in North America. Cancer management, we've got some Commonwealth countries. We've got India and Indonesia. Interesting stuff. And then for predictive medicine, we can also see the related terms. For predictive medicine, we can see that's definitely, according to search engines, a very American topic, at least for now. It's very innovative, it's very new. So if I'm not sure about using worldwide, I'd rather actually narrow down a little bit. I'm just going to tell it to use Canada. And I'm going to start looking at regional interest in this country. This is really going to help me when I start understanding where my audience is and who's using search engines to get where. I can start seeing who's talking about these same topics that we started with. I can start seeing how they correlate in Canada to people who are looking for this information. This is really, really valuable when you're up front trying to explain why it's important to have a whole new web page or a microsite or a something about certain topics. Got a little, and there's not enough in predictive medicine just yet. It's still very, very American. So this is a free tool. It's not covered in ads. It's something that you can just use. And it's Google reporting on itself, telling you what people are using Google to find out. And for health communicators with literally zero budget for this type of research, it's pretty great. So I recommend you giving it a try. The next thing I want to look at is something called Consumer Barometer. This might strike some fear into some people's hearts. This is made for a marketing tool, but don't be scared. It's mostly that marketers can be convinced to pay for things, whereas healthcare often we're a little bit further down the food chain. But it's also a free tool. So without further ado, I'm going to start looking at a topic. I'm going to decide that I want to know about a consumer attitude. I want to know about the number of people who think that websites recommended by friends are more important or most important. And I want to know what that is all about. I want to choose a gender. I'm just going to see what the ladies have to say about this. And I'm going to choose a country. I'm actually going to look at Canada. I'm not going to look at just North America. I'm going to decide that this is information I need for whatever campaign is about to take place, whatever initiative I want to push. So I can see that 52% of people think that websites that are recommended by their friends are more important than other websites. These are women in Canada. This is live. This is really helpful information. I'm just going to get through it, and then I'll take questions at the end. Using the tool, I'm just going to show you a little bit about how the data mapping works. So you start choosing some of the different data points that you want to use. So I can segment my audience by, let's say, high internet usage. We really want people who are using the internet a lot. I'm going to choose maybe Canada, again, hopefully. I think that we're interested in Canada in this room. I'm going to maybe decide on some different topics as well. I can think about how my device usage is going to affect what I want to present and where I'm going to present it. If a lot of people are on telephones, maybe I want to focus on social media because those things are already ready for your device. If people are, in this case, more on desktops, maybe I want to think about a microsite that is less expensive to launch, but is where the people already need to be. So making these different decisions can actually help you, even before you get into a budgeting decision, you can decide what you're going to make, how you're going to make it, and perhaps what you need to get a quote for. This is really, really handy. So if I've decided that my purchase behavior is interesting, but not quite so interesting for what I want to accomplish, I can actually go back and I can look at consumer attitudes, So this is a segment of people in Canada who use the internet at a high volume, who think that websites with local search results are very, very important. That's handy. That helps you know whether or not your Google reviews matter, whether your Yelp reviews matter, whether other people sharing your website to other people, that's like recommending your website, matter. So understanding these behaviors and these attitudes before you even get into what you want to accomplish for your initiative can help you actually set the scene. You can kind of promote that you're going to succeed with this campaign because you have this groundwork done. And again, it's free. So that's a lot of external data. I hope that didn't go too fast. I'm happy to repeat a little bit of it maybe at the end when Ian is done. Looking at your internal data, a lot of people or a lot of organizations might have more than one channel. Maybe you've convinced somebody to get a Facebook page. Maybe you've convinced somebody to get a Twitter account as well. Maybe or maybe not, they're working together. And when you start measuring, you're using your Facebook analytics, you're using your Pinterest analytics, all of these things together. So putting them together on the same page is really, really handy. And a local firm called Hootsuite has actually made it possible for you. There's other products out here that do this. Because they're $10 a month, I choose them. You don't have to. But it's also handy to understand how to put data together and what data should go together. So they've very kindly given me dummy data to look at. So I've made choices about comparing keywords, choices about Facebook pages. I'm going to choose a source for likes. I'm going to choose maybe a reach by region right next to it. And when I put those two things next to one another, I can start to understand a little bit about what people are doing on my Facebook page. I'm also, I think, going to look at my Google Analytics. I'm going to look at the top performing content. These are just the most popular pages. And I think maybe since I share shortened links in a lot of my messages, I'm going to see which ones are the most popular, which are shared most often. And notice, when I now put these two things together, the content plus the links, I can start to understand whether or not those links are performing in a sharing sense, in a social sense, not just in a traffic sense. So I have a lot more that I can put together in one place and express to other people. If you don't have $10 a month or your executive team does not feel that it is important to invest in this, that's okay. You can still put these types of data together and start telling that story that Janelle was talking about. So these are really, really handy, mostly free, almost free tools that are available right now. So that was 3 handy tools. There are many, many more, you guys. There's lots and lots of tools. Basically, if there's a channel out there that you want to be on, there is a tool to analyze that channel. You can now get your data from lots and lots of places that we saw before, but also Pinterest Analytics, LinkedIn Insights, your email analytics, Clout Scores, all kinds of things. So your data is invariably going to break the minute I finish. So I'll just read it to you. It can and does come from many, many places, and I think in future it will continue to come from many places. So understanding and aggregating all these data is now and will increasingly be a part of communications. It's not business management or financial analysis or human resources, it's communications. In healthcare, we hear from people who receive care. We hear from patient ombudsmen, government advisors, donors, academics, prominent physicians. We hear from competing interests. So from internal and external sources, they are all going to exert pressure on communications to accomplish many things. So my hope is that you will use your data wisely to accomplish your goals. There we go. That's me. I think I'm gonna, I think I can answer one question and then I'll let.
I didn't understand where the information for the consumer barometer comes from. Like, how do they know that 85% of people that are high internet users?
That it's a proprietary tool from, you can turn your mic off. It's a proprietary tool from Google, so they work with ComScore to aggregate and manage all of that data. Run by Google, data comes from ComScore.
And sorry, what surveys?
ComScore surveys and other things. Yeah, it's an industry secret, it's a trade secret, so they don't actually tell you everything that they don't show their work. I really need to let Ian get started, and then I promise everybody we will do questions at the end.
Okay. Thank you. So thank you for having me here. I hope I can provide something of interest or value. I'm not making any promises, but I've been at the BC CDC for about 8 years now. What we do is really to try to provide leadership in public health around things like surveillance, prevention, detection, treatment. The kind of main areas that we work in are communicable disease, so immunization is an area that I work a lot in, and public health emergency management and environmental health, so things like food protection, radiation, etc. Raw milk.
Bad cheese.
Bad cheese, yes. Cook your hamburgers, 74 degrees, please, everybody. West Nile virus, use DEET. I've been involved in communications there. That's how I started out, and then kind of morphed into promotion with immunization, and now kind of do a bit of both. That's the short story. A stroll down memory lane. Fortunately, there are no pictures of the old website that currently exist anywhere, and they've been banished. The old website, how I try to describe it, is kind of like a 1971 Pinto. It sort of got us there, but we didn't travel in very good comfort. So our goal with the new website was, we didn't want a Ferrari, but we wanted something that was reasonable and manageable, like a Toyota. The problem we had historically within the organization was really around, because we had an old crappy website, a real sense of apathy and disconnectedness that really came with that. I don't know if any of you have experienced that in your own organizations, that the website is just sort of there and we try to ignore it as best we can. And so, as a result, it really wasn't a top of mind communications channel. And so when I came in to try to address a little bit of that, that was the environment that I was working in. About 70% of our traffic was domestic at that time, and 30% international. And the new site had about 1,500 pages, so we were ramping up a fair bit. This is a screenshot of the new site. So what I'm going to do first is go through some of the boring stuff, web page stuff. I know you guys are into fancy Google Trends and all that stuff, but I'm not that smart. So what I did over the past 3 years is I did a year, part of my job was to kind of do a year-over-year analytics look back at traffic. So in the last year, I did a 3-year kind of analysis of how we were doing over the last 3 years, year over year. So there's sort of good news and bad news on this. The good news so far, this year we had about a 79% increase in traffic. Not really sure why. We have zero budget, but I'll take it. So that's a good thing. And it also, it excludes, our analysis excludes IP addresses from any PHSA agency. So yes, it is my homepage, and I hope it's all of your homepages too. But if you're in the PHSA, then that wouldn't be included in that number. So correspondingly, yes, visits went up 75% in the last year, and continue to go up since 2010. Number of downloads. We have a lot of documents on our site. It's a very document-heavy site, considering the kind of work that we do. We have lots of manuals and guidelines and statistics and reports and annual reports, etc. And so our downloads have also increased a lot. Page views have also increased, not by as much as you can see, but they continue to go up, and we're very happy about that. And international visits, really interestingly, this was something that really threw me when we started to look at it. Compared to our old website, where most of our traffic was domestic, now most of our traffic is international. And I'm going to talk a little bit about, we did an online web survey to kind of dig into that a little bit, but that really said to me that we needed to be, cognizant of that, and maybe reflect some of our content on our site appropriately. So this is now the bad news. So we had all this increase in traffic, but we also saw was our page views per visit have started to drop. So more people are going there, but they're not looking at as many pages. And so we're just above 2 in 2012. So this is done at the end of 2012, where we're at about 3 pages. So that's a big drop. And not surprisingly, the average and median duration has also dropped from to about 29 seconds is the median duration, which is the real number that we're interested in, not average, as opposed to 43, I think it is, 43 seconds. So what do we do with all that? We also noticed that referring sites, the top referring sites, we were getting lots of referring from international Google traffic. And so that made sense from what we were seeing with our international traffic going up by so much. And it suggested that we were getting a greater profile with international search engines, which may also explain why we're getting an increase in traffic to such a degree. So some of our highlights, overall, our increase in traffic, we think, it's a result of the site, yes, being better integrated into international organic search engines. That I wish I could take credit for that, but we did do an SEO analysis that, I think helped us a little bit. There were a number of things from the SEO that we did that some of the things were really, if I can say, really technical oriented that our IT folks kind of had to implement, and some of the things were things that we could do, like with things like alt tags to help our SEO. So maybe we can take credit for that, but a lot of it I think is just that the site has become. It's not new anymore, but since 2010, it's become more and more embedded in international search engines. I was happy to see that our Canadian traffic also increased by 50%. It also, we found out, only 1 out of 10 visitors came to the site more than once. So that, said to us we needed to have a little bit more engaging content, or the continual need for more engaging content. The correlation of reduced time on site with international traffic increase. one of our theories is that people are searching for CDC, because that's more well-known than the BC CDC, are finding us and hopefully liking what they see here, because if they're looking for typhoid or diphtheria or cryptococcus disease and they want to know what it is, as long as it's good information, then hopefully they'll be happy finding us. But that could be one of the reasons why the time on site is down a little bit. And it also suggests that the content is not as fresh as it could be, so there's a continual need to do a better job. So that's sort of an overview of the analytics that I did recently. I'm going to step back. Prior to this, I did a strategic plan for the website. It was sort of one of my conditions of employment when I came on board. The COO said, you need to do this, please. So there were 4 main points in the strategic plan. I'm only going to talk about 2 because of time. But you know, overall, we wanted the BC CDC website to be a tool to support all of our core functions around public health, surveillance, treatment, prevention, etc. And you know, we measure success in these 3 ways. We hope it's embraced by users and that there's high degree of satisfaction and ability to complete task, whatever that task might be. It's supported by the management and staff. It's no small feat considering what we inherited prior to this. And it's really considered a value point for the organization overall. So the first one, here are the 2 that I'm really going to talk about in terms of the strategic goals. There were a couple of more. One was another one was around evaluation. How do we evaluate the site? And another one was get the basics right, then innovate. So I was talking about how we could do some innovative things, but I'm not going to talk about those. So increasing online maturity within the walls of the BC CDC. With both of these, the action really is to what I took from this, and what I try, you know, if I could impart anything upon you, would be to try to drill down as much as possible within your departments to try to make whatever message you're going to be presenting relevant to those departments. It's really simple. But it does take some work to do, and it does take some little bit of patience with the analytics, for example. So increasing online maturity, we really think, you know, we did have that was one of the problems identified in our strategic plan, is that because it was an out of sight, out of mind website, our lowest hanging fruit really were the employees themselves. And we needed to engage them better. And yes, the past doesn't determine the future. It's a new day. The glass is half full. Solution was a roadshow. It's not really a roadshow. I kind of went to this department, that department, you know. But for me, it was exciting. So, you know, we have different, it's changed, but now it's called service lines. So we have a service line for clinical prevention services. That's where we actually do treatment for TB, STIs, and hepatitis. We have immunization. We have, you know, laboratory control. We have environmental health. Those are the different kind of service lines that we operate in. They tend to, and this might be relevant to you, they tend to operate in silos, even though we're in the same building, and that's always continually difficult. But that's what it is. So this is an example, and this is just, you know, I'm not going to actually go off of any of the slides on this, but get into any of the detail. But this is an example of what I did for the roadshow for when I went to the STI group. I looked at the analytics and tried to tease out what was relevant for the STI group. And you know, one of the things that I wanted to compare it with was, well, we've had, what is it, 9,500 visits to the STI-related pages, and you've had 10,100 visits, actual visits, to the clinic. So, you know, let's put it in perspective. You need to consider this. This is a legitimate thing to be cognizant of. You know, whatever you put on this website, the impressions that people get from the website really form their overall impressions of the STI or the BC CDC by extension, and the brand. And so did that, and then, you know, looked at the most popular downloaded reports, and what was most viewed, etc. Really to start a conversation with them. That's the entire point of it. We also did a survey, an online survey, which I won't get into real detail about, but I actually had it in this originally, and then I took it out because it'd be way too long and you'd be wanting to get out of here. But we did an online survey, and we got lots of data from that, lots of really good stuff. But one of the things that I did in this case was take out, from the, 500 comments that we got, I scoured it all and went through the comments that related to STI. And I have a PowerPoint for all of our departments. I did the same thing for hepatitis, did the same thing for immunization, and put them all up there for them to see. Really, again, as a starting point for a conversation about how, what intelligence can we gather from this? How can we make your website, the section of your website better? And so that's what we did. Web governance. So the other thing I wanted to talk about was how we set up web governance at the BC-CDC. And this is something that I kind of partially inherited when I took on the job in sort of late 2009. And so some guidelines were already established. But implicit in this was that you needed to proactively manage the website in order for it to be successful. It needs to be on the front and center of someone's desk as opposed to the corner of someone's desk. So this is an example of one of the things that was set up. Here's the basic org chart. We have a distributed model for how our website is actually updated daily. And I know there are pros and cons to doing things centrally and doing things distributed. We think this works, and because we have 1,500 pages, there's a lot of content, it needs to be changed a lot. So I basically act as the go-to person at the BC-CDC for our content editors and authors when they can't do something, or that someone needs to be trained, or they can't remember how to do something. I also author to the site a fair bit. So, yeah, as I said, we do have this distributed model. My job really is to act as that first point of contact. I wish I had the opportunity to do this more often, but I think one of the most important parts of what I do, and I think if you're in a similar position, what you should try to do is really to act as an advocate for accountability, for getting on that soapbox to say this is a very legitimate channel, and it needs to be recognized as such. At the executive level, that's not always the case. I think intellectually people get it, but really getting it and actually assigning resources to it is a really hard road. We have zero budget. The only money that I can get really comes from special projects. If I can make an argument to do an online survey, which I'm about to do again, for example, I might be able to get a few dollars. Or, I just gotten approval to get some improvements and enhancements to the website done. It's only taken me 3 years, but got it. And then the other thing I do is I chair the Web Council. So the Web Council really is just a group of authors and editors that have been trained. We get together 3 times a year. We developed a term of reference, and the most important thing that we do within that, I think, is to at least try to develop some kind of regular reporting mechanism for content updating. And this is really hard because we have a lot of pages, we have a lot of content experts who are really, really busy. And trying to get them to do anything is really difficult. I don't know if that resonates with any of you, but it certainly is the case with us. That's not to say that we shouldn't try and try to do the best we can. So what I've tried to do is to do some things that can make it as easy as possible for people to actually do the work. And one of those was to create a content review spreadsheet. And it doesn't look very good on PowerPoint, so I'm not going to show it to you. It's a spreadsheet. But all it really is that we have, it's an Excel spreadsheet, and there's tabs in the bottom that the tabs correspond to all the major channels on the website. And then if you click on, the immunization tab, you'll come to, level 1, will be the home page, and then you'll see level 2, you'll see the left-hand navigation, each of them, and they're all highlighted, hyperlinked, I should say. And then level 3, level 4, whatever. So, it's basically the website in Excel spreadsheet form. After all of that, there are several columns, but basically the point of it is to act as a resource for the department to use as a process for content review. So it says, for this immunization page at level 5, who is the content expert responsible for this page? Oh, it's Monica Naus, okay. Who is the content editor responsible for this page? Oh, it's, Ellen. Then there are several other columns to say when this page has been updated. There's notes pages, etc., that allow some kind of process for people to actually manage. I've got 150 pages. Where do I start? Well, here's where you start. So that was the first thing and this, I didn't get this. This sort of just made sense at the time. I don't know if it's the right thing to do, but it just kind of made sense. So that's what I did. After that, what we, in the spirit of trying to make it as easy as possible for people, we're finding that not everybody was updating their pages. I made it easy for you. But so another thing we tried to do was we have a stale fresh pages kind of application where we can look at pages that have not been updated, let's say in a year or so. And we have an expectation that every page on the site gets updated once a year. That means a content expert has looked at it. Even if there's no changes, someone's looked at it and updated the timestamp. So it says, someone's looked at it. And still, it's really, really difficult because the content editors that report to me, in a lot of cases, they're executive assistants or secretaries. They don't have any direct authority to actually get content approved. So we have a process also through our operations managers who are really supposed to, get it done and make sure that the content experts are reviewing these pages. Anyway, so what I also tried to do to make it as easy for people as possible is to go through all the website, get the stale fresh pages report and get a printout of all the pages that hadn't been updated in a year. And here, this is an example of pages under diseases and conditions. One is the main pages and one is the overview pages. To be fair, a lot of these pages, the content's pretty static. The treatment for flu is not really going to change that much. So, but still, they still need to be looked at. Then what just to make it even more interesting, we highlighted in red those pages. I cross-referenced these pages with pages on the site from the site analytics that were also high traffic, what I deemed to be high traffic. So I won't get into that, but so to say, okay, these are the pages that need to be updated the most, but the red ones are really the ones that need to be updated the most. Please. And so you can see I also did it by channel, and those mostly correspond to our service lines. And so here, food in your health and health in your environment. The red ones are the real critical ones. So lastly, the only things I can recommend would be, one of the ongoing problems we've had is actually getting people to actually do it, right? And we have an accreditation process that we go through every 3 years, which is very, very detailed and taken very seriously at the BC CDC. If we get whatever rating we get really is a brand extension of how good we are at what we do, I guess. And we've had some accountability on the website, but it's been very vague. So my push is for the next accreditation is to make content review directly accountable and directly related to accreditation. And that I hope will make some people aware of why we should be doing this. And seems fairly obvious, but listen to the people that are on the front lines. We have about 20, 25 editors, and usually because they're doing content review and editing every day, they have a lot of good things and experiences to share. And most importantly, it's this idea of don't let the perfect get in the way of the good. When you have zero budget, do what you can and work within the resources that you have. We had Excel, so let's make an Excel spreadsheet and try to make a content review spreadsheet. Whether or not people do it, you have to do the best you can, and that's a continually evolving thing. But whenever you have a soapbox to get on and spout about the importance of the channel, do it, because that's your chance and that's what you're supposed to be doing. So that's it. Sure.
Hey, who are the top 3 audiences or target audiences for your website?
Really, they're health professionals. So that and this is one thing that came out in our online survey. We had the best information we had prior to the survey from the old website is that it was mostly public, about 60-40, but it turned out that health professionals were about 60% of our audience, and 60% of that 60% were public health nurses. So really, that was a real eye-opener. The public is definitely also a big one as well, but when we looked at top downloads for our website, the Communicable Disease Control Manual, which is a guideline, this big guideline for health professionals on what to do in a case of, was our most downloaded and consistently is our most downloaded document. So that kind of backs up the online survey. So health professionals are really our big audience. General public, sort of second, and we have other kind of smaller audiences like international researchers, students, but they're much smaller. Yeah.
You had the question from before, I think?
Yes. I had a question about sort of search engine analytics, especially for sort of prospective programs or campaigns or like research questions where, like with Google Trends, you can tell, say, if more people are searching for a term or associated terms with that, but it's really hard with Google to tell who's looking for that information, like whether, say, if you are, I'm using an example from a paper I'm working on, but say if you're looking for people, members of the public who are searching for information, but if you're looking at medical or scientific terms, it's hard to tell if those are being searched maybe by health professionals or physicians or people who aren't members of your target audience. And I don't know if you have ideas or thoughts about how to tailor that.
I have some ideas. That's a really good point. All of these channels sort of look at different things about what they personally are interested in, personally. So Facebook is really interested in demographics. They want to know your name, your age, where you live, what you like, all of that type of thing. Google doesn't super care who you are. They care what you do and basically what you buy. So there are things that you can do to take those things and put them together. So far, there's not a great free tool out there that puts it all together. That's still purchased market research if you want the creme de la creme. But in terms of the budget conscious, you could try Think Insights with Google. A lot of it is US, but there is quite a bit on Canada in there. Top of mind, you would probably get something out of what moms search for in terms of healthcare. They do have a whole healthcare section. And a lot of the attitudes are, I don't want to say that they totally translate from US to Canada, but they're culturally very similar to us. So we can easily talk about attitudes towards getting healthcare, if not buying healthcare or attending healthcare. So you can start there. But that is definitely something to keep in mind. With all of these channels that we have, they have lots of data, but they also have lots of limitations, for sure. Hi, Justin.
Hi there. I have a question about Google search engine optimization. Aren't Google search results unique to the individual and to the computer that they're using it from? Because what I find sometimes is, I'll celebrate if one of our health terms comes up first on my browser.
On your browser.
My browser, but I realize someone else tries it from another area and it's like number 3012.
Yes, so really good question. Google, in addition to basically all the other search engines out there, are trying to tailor as much to you as possible. So if you're using the same browser over and over, or if you're logged in, this is another thing you'll find across browsers if you log in, you're going to start seeing tailored information. So for search engine optimization, Ian touched on this a little bit. There are technical things that you can do that will not necessarily affect, they'll just work across any browser. And in terms of content, what you really want to focus on is more than one strategy. You want to have a personalized strategy with really, really long tail keywords. That's just an industry term that means a very specific keyword. It usually has 4 or 5 actual terms in it. But you also want to have really, really strong, broad categories right on your front pages so that for people who are looking from different perspectives will still get to where they need to get to. Yeah. Hi, yeah.
Hi, how much clout does your clout score actually have?
I think it's a great place to start. If you're looking for people who are interested in a certain topic or have been promoted as an authority on a certain topic. I think very much like lots of these analytics tools, you really can't just take it and run with it. I think that's what a lot of what Janelle was trying to say is that there are lots of data points out there. There are lots of things that can be interesting. I think clout scores are interesting. I don't think they're the end all be all. That's not a whole influencer strategy by itself. It's a place to start.
And one of the things that we did when we did our online survey was we did I think it's called a normative data comparison. So we asked some basic questions about the ability to complete tasks and, user satisfaction and stuff. And then that was compared with a larger data set of an N of about 30,000 websites that were asked the same question. And so when we got 7.2 out of 10 for ability to complete task, that's either really good or really crappy, depending on what you think 7.2 out of 10 is. But when you compare that with how the industry, a larger N does, and if it's 6.8, then you're doing better. You're doing better than a lot of people, or worse, depending on what the answer is. So that kind of gave us something to hang on to, I guess, to say where we are in a sea of other websites and people trying to do the same kinds of things.
I think it might also, this is probably a good point to bring up the varying levels of sophistication in your executive team. You might have a CFO who is right there, who understands the difference between an open rate and a click rate, who can talk about all of these data with you. You might have another member of the executive team who has no idea what you're talking about and is just kind of going along with it. These are the people who will take a clout score or a traffic or a page view, a something, and they will hold on to it and they will not want to hear the broader context of what all this stuff means. So it's actually really important to think about whether or not these stories that we're telling contain something really, really interesting or something that can seem interesting but actually isn't very effective. Hi, Justin.
From your work with various clients and senior executive teams, what are those 3 measurements that makes them go wow, that they kind of like jump onto and just get really excited about?
It's often unexpected. It's really different per team. I mean, people care about traffic. Some people really care about bounce rate. Some people really care about devices. Look how many people are using the same phone as me. It's really different depending on the team. But I will use your question as an opportunity to remind everyone that context is also personality driven. There are things that people, just as people, are going to be interested in hearing about. So when you talk about knowing your audience and presenting data, it's not just about whether or not this department is interested in one particular topic, which they probably are. But if you get to know your people really well, you might understand that they really like certain things and they want to hear certain things. So you can make decisions about getting something out of the way or putting it in the middle of something that you want to use to tie everything together.
They also get pretty excited about when your analytics matches their capacity. So for example, if they don't have capacity for a newsletter, but they've been doing it for years and years, and then your analytics show that the newsletter is actually not very useful for your organization, they're pretty happy because they feel like this is now data to give to their executive team to say, this is not a valuable use of our time. Maybe we should be moving on to social media or whatever channel that you want to go to. I think we're good.
We're getting close, guys.
Okay.
These are great questions. Thank you.
Yeah, I think that's it from the audience. Danny, you want to come up and just explain the... Thank you. Thanks, everyone.
Thanks, everyone. My head is certainly swimming in analytics. I just want to remind everyone that the next evening rounds will be a treat. It is a social event, and it's a chance for all of us to get together and meet each other, have some conversations, meet other people, talk about ideas, talk about projects. So it'll be a more socially focused tweet up type event. It will be June 18th. It's the third Tuesday of every month typically, and we'll have more details on where that's going to take place very soon.
Virtual, or will it be in person?
I'm thinking it will be personal. Yeah.
It's also the last one before we take a break for summer.
It's the last one before we take the summer break. Excellent. Thanks to everyone for coming. Thanks to Robin and the Signals crew and to Justin for having us. And we look forward to seeing you next time.